Hi everyone, I'm Malia Kirby, one of the practitioners on staff here at Blue Poppy Enterprises, and today I'm going to talk to you about some of my favorite needles that we sell here at Blue Poppy. Now, I'm going to start out with everyone's favorite, the Seirins needles. Everybody knows these needles. It's because of Seirins that we actually have single-use disposable needles in the first place. They were the pioneers for our field. And the main things that I love most about Seirins needles, particularly on the J-type needle, you're going to have this plastic handle, which unfortunately you're not going to be able to see on the video nearly as much, but this plastic handle has quite a bit of tread on it. So you're going to have a nice, comfortable grip hanging onto that needle as you're inserting into your patient. Now, the second thing that I enjoy most about these needles is the tip. Now, say that this part of my arm is going to be the needle shaft, the tip on the Japanese Seirins needle is going to come straight out from it, in comparison to a number of other Chinese needles, which are going to come straight up and then have a conical tip at the point. And the main difference that you're going to have with that is if you're doing any sort of Japanese techniques, such as what Mikishima teaches, such as Drunken Rabbit or anything like that, that style of tip is going to remain much, much sharper for much longer, so you're not going to be poking a dull needle into your patient, which is very beneficial. So that's the Seirins J-type needle. The next is going to be the Seirins D-type needle. And the main difference between that is that with the D-type needle, you're still going to have the plastic handle, but you're not going to have the added waste of the guide tube. So it's going to come without the guide tube. And these are going to be more beneficial when you are doing any sort of auriculotherapy or if you are a facial rejuvenation specialist. These are going to come in quite handy. Or if you're a person who also prefers to do a lot of freehanding, then this is also going to help reduce some of your waste and reduce some of your carbon impact on the earth. So that's the D-type needle. Now, one of the main complaints that I hear most people saying about Seirins needles is going to be the price. Well, we have a needle in stock for you. It's the Teva needle. They are German. We actually have another video demonstrating the Teva needles. But what's cool about these needles? Three things. So we have, first and foremost, the same sort of tip that you have on the Seirins needles, so they're going to be just as sharp. And on top of that, we have two other things. So first and foremost, you're going to have this little extra piece of plastic called the safety sleeve. And what's important with that is that you're going to actually be able to maintain your clean needle technique when you are inserting longer needles or if you're threading. That way you don't have to be reaching for sterile gauze or anything like that, and you're not going to be contaminating the shaft of the needle, which we all need to be concerned with, particularly with all of the diseases out there such as MRSA and other antibiotic-resistant bacteria. Now the second thing, let me get rid of some of this plastic here, that's cool about these needles, is that they are bimetallic. So the shaft of this needle is going to be your good old-fashioned stainless steel. Oh, and also the shaft of the needle is completely coated with silicone all the way from the tip to the handle. So you're going to have a much, much easier insertion there. But getting back to the bimetallic needles, as you can see, the handle is going to be the traditional copper handle. So you kind of have a little bit of the best of all the worlds out there, whether you're looking into Chinese, Japanese, Taiwan, Korean, all of the different branches of acupuncture that we have out there. This right now is pretty much the ultimate needle right now. Plus on top of that, it's cheaper than Seirins, so much appreciated there, especially on your budget. Now, last but certainly not least, the main problem that you have with the Seirins J-type needles is that with the plastic handle, you can't do needle top moxibustion, which I don't know if you're a moxa queen like me, but I burn a lot of mox on my patients, so I have to have some sort of spiral and loop type needle. And these that I'm opening up here are the DBC needles. These are a very, very comparable needle to Seirins. I love them a lot. And as you can see, I have 10 needles in one package, so I'm going to be reducing my waste, and I only have one guide tube, also reducing my waste. So all you really need to do is make sure that you get used to keeping your guide tube rather than throwing it away or throwing it in your lab pocket, and then just reload each time. Very smooth insertion with these as well. And as you can see, we also have the spring handle on the DBC needles as well, so your mox is going to be less likely to fall off as you would on the pipe handle that you have in a number of other types of needles out there as well. One other thing about the DBC needles I should mention as well, these come in 1,000 needles per box, so you are going to be receiving a price breakdown of approximately 2 cents per needle, which is going to be your most economical needle out there. So it's also a great needle to have in your clinic just for your pocketbook alone. Plus, it's an awesome needle. I'm pretty sure you'll appreciate it as much as I do. And as we all know, our needles are all going to be what we appreciate the most. So they are our bread and butter of our practice. So if you have any questions, feel free to give us a call at Blue Poppy. We'd be more than happy to answer any of your needle questions that you may have. And it is 1-800-487-9296. That's 1-800-487-9296. Hope you're having a great day, and thanks for watching. Bye-bye.